Hi, and welcome to the Healthcare CEO Show, where you'll find actionable insights on healthcare leadership from the best and brightest in the industry. I'm your host, Daniel Fernandez. Let's get a pulse. With me today, I have Dr. Edmondo Robinson. Now, before we get started, let me tell you a little bit about Dr. Robinson. He is the Senior Vice President and Chief Innovation Officer at Moffitt Cancer Center. He is also an Associate Professor at the University of South Florida's Morsani College of Medicine and holds both a medical degree and MBA with an emphasis in healthcare management. Welcome to the show, Dr. Robinson.
Thank you for having me, Daniel.
Now, one of the topics I want to cover today is, obviously, it's a hot topic. It's the pandemic, right? And it's impacted every business, every industry. It's impacted everything globally. What are some of the ways that Moffitt has leveraged some digital strategies to kind of to adapt to the changes because of this pandemic?
Yeah, I mean, great. It's obviously a common question because we've all had to adapt, adopt, adjust, whatever it took to get going and keep going. A couple of things that we really needed to do, and we needed to do it quickly, which is one, we had to get our workforce that didn't need to be in the clinic or in the hospital. We needed to get them home and working from home. Big push for that. So the work from home effort. And then the second part is we needed to keep our patients home if we didn't need to bring them into the clinic, right? And so we did both those efforts. So essentially the work from home and then virtual care.
Okay. Is
right?
it because they're immunocompromised patients for the most part?
So there's a mix, right? So not just because you have cancer doesn't necessarily mean you're immunocompromised. Okay. But if you have cancer, you're more likely to be immunocompromised. So yes, there is, and so it just, if you were unfortunate enough to contract COVID and have cancer, like you just don't need that complication, right? Like let's avoid that if at all possible, right? That's true for many infections actually, but it's definitely true for COVID. So, so it's just being safe was just the right thing to do. And we started to assess and evaluate what needed to be done physically and, in physical proximity from a clinical perspective and what didn't. And so we had a really heavy push, within a couple of weeks, we increased our virtual visits by 5,000%. Wow. And we, at the height of it, maybe a month or so, maybe a couple of weeks after that, we were about 7,500% increase. We've come back from that a little bit. So that was sometime in, say, April-ish, maybe early May. We've come back from that a little bit, but quite frankly, we are going to have an increase in our, it's going to be steady in terms of our percent of virtual visits. Okay. It's not going back to where it was before. It's never going back to where it was before. There's a new baseline at that, and it's going to probably grow from there, depending on the clinical scenario. So that's a clinical care, and that's just how we're going to be delivering care from now on. It is how it's going to be. And then work from home, like all many other institutions, healthcare or otherwise. Do you really need to be on campus? Do you really need to be in that office? And so we did a pretty deep assessment on that. And we decided that, there's a hybrid model, there's a full work from home model, and there's, you really do need to be on site type of approach. And then our teams on the IT side, you think about the lift for work from home. If you go from everyone was on site and now we're working from home, there's a huge IT lift actually. Just getting the technology up and running. Some people have laptops, some people have, desktops, and just that whole transition. And we had to do that like quickly. And so, those efforts are running in parallel, by the way, at the same time. So, and again, we're not going to go back to where we were before. We actually had to reassess our leasing strategy for office space, because like why if we're gonna have this percentage of our overall employee base working from home, do we need to lease as much office space? So I'm imagining that the commercial real estate sector is going to take a hit, is my guess. Because I think a lot of organizations are having the same conversation.
So suffice it to say, the world is somewhat changed forever, whether it be patient expectations or, employee expectations. Yeah. Sounds like.
I would say definitely significantly changed forever. One way I like to describe it is we essentially developed 5 years worth of innovation in virtual in about 5 months.
That is incredible. Are there strategies that were rolled out, besides your telehealth and remote services that you foresee remaining long after when everybody's been vaccinated? I've learned a little bit about the curbside clinic, for instance.
Curbside clinic, yes. So the curbside clinic is a great example where essentially you drive up and there's a menu of services that we provide, that we have provided for many years as a cancer center, that we can provide while you're in your car. And we literally roll out. It reminds me of those the old school diners, right? Where you drive up and the folks come out and they deliver your service that way. We basically have highly trained nurses and staff coming out and delivering those services and making sure that you're able to, one, be safe, but also still receive your service. I mean, the cancer's not going to wait because we're in a pandemic, right? So that's one of those. It's been such a hit, the curbside clinic, right, that we're not just going to continue, we're expanding it. Wow. Okay. Yeah. So that's just going to continue to grow. There's other strategies that we had to think about in terms of how do you build a digital ecosystem around your patients and their caregivers. So I want to call them, I'll call them consumers. Okay. And the caregivers. It's really important in cancer, and I think this is true in a lot of other health issues as well, but in cancer, you have to pay attention not just to the patient, but their entire kind of care team, their family, their loved ones, their friends, the folks who are really supporting them through the cancer journey. So I group them into this, overall as a consumer, as consumers. What's our digital ecosystem? And I use that phrase specifically because folks often like to say, okay, then do you have a patient portal? Okay. Or do you have an app? That's not what I'm talking about. Right. It's not, at least not in totality. It really is a digital ecosystem. So yes, it's mobile. Yes, it's, do you have some kind of login on the portal, but it's also, do you have search? Do you have online scheduling? Do you have online bill pay? Do you have, Alexa, app devices and commands that you can control? Do you have remote patient monitoring? Do you have wearables? Do you have, you see what I'm saying? There's an entire digital ecosystem that we want to build around our consumers. And that strategy has been accelerated. And I think that's going to continue to be accelerated through even as we come out of the pandemic. Let me tap into your strategic planning brain for a moment. There's been a recent trend whereby leaders have felt the pressure and have had to roll out a lot of things very quickly. A lot of strategies have shifted towards like short-term gains in the 45 to 60-day window. Do you sort of agree with this trend? Do you think there could be detrimental to the organization? Yeah. So I have a couple thoughts on that. That idea. Yeah. So you needed to respond to a world-changing event. I mean, let's just be honest. You had to, if you were going in one direction and that direction wasn't going to keep you viable, then you had to pivot. I mean, that is commendable for folks to make that shift. That being said, there are ways that you can do that make you long-term viable as well. Okay. It's not just about getting through the next 60 days. It's about really, again, long-term viability, so that you can achieve your mission. That means that you should leverage what you learn in your pivots for that short term to be even better in the long term. So you should be capturing that learning and really thinking about what should we keep and what was just for the short term, but what actually, to your point, to your question, what really is here to stay. So again, curbside clinic. Wow, we would have never curbside clinic if it wasn't a pandemic. Yeah. Well, guess what? Everyone loves a curbside clinic, so we're going to keep it, right? And so so part of it is make sure that you leverage that pivot to go longer term. But I would be very cautious as a leader about focusing heavily on the short term, even though you need it to get through these challenging times. Right. And not paying enough attention to the medium and long term. You still have to pay significant attention to the medium and long term. And because what happens is you're constantly building infrastructure and building blocks for the next step. And if you let that slide, it's going to take you that much longer to get get to where you want to go. So you still have to have that longer term. So what I like is actually a combination of the longer term vision as well as the being able to immediately respond. Your longer term vision should be flexible enough to allow you to pivot as market conditions or, I don't know, a global pandemic might need you to pivot. So you shouldn't be so rigid in your longer term vision and strategy, but you still should have it, right? So what we did, as an example, is we actually have a 10-year plan that's broad and flexible, but it directionally we know where we're going. And we, as inspired by the pandemic, we said, let's have a strategy refresh. Let's go through a process of refreshing our 3 pillars that we're focused on in our strategy, and let's assess if that's still where we need to go. And we refreshed that and made some adjustments to our longer term strategy based off of what we learned from our short term pivots that we used.
And speaking of next, let's talk a little bit about what's next for healthcare. Our natural tendency during times of uncertainty is to pause, sort of wait for the ground to settle. When it comes to the digital tools and technology, do you think it's time to pause, or do you think it's time to lean in or accelerate into that?
There's one school of thought.
Okay.
Would be that there's going to be winners and losers from a digital health perspective.
Okay.
And where that's going to may land out is those folks who are best able to add value.
Okay.
Leveraging digital during this time are the ones that are going to come out of this not just intact, but actually with large growth. Wow. And there's others who are not able to respond or not able to truly add value in this time that are going to struggle.
Yeah.
So that may apply to early stage companies. That may apply to larger established companies. That may be applied to providers as well. Healthcare systems and cancer centers and things like that. But there could be winners and losers depending on how that marches out. Again, depending on how you might leverage your digital tools. I would say that everyone had to respond. Everyone's doing some work from home. Everyone's doing some virtual.
Right.
Zoom, if you're an investor in Zoom, good for you, right? Like that's pretty established, right? But if you are just trying to survive through this, you're going to struggle when it's done, is my opinion. If you've taken this as an opportunity to accelerate where the world was going anyway, you're going to come out even better than maybe you even went in.
I like that. I can see that. There's also, I've noticed a sort of a consolidation of tools and technology as well. Are you starting to see some of that?
That's an inevitable. That's going to happen not just in tools and technology, but also in the health systems themselves. There's going to be a lot with challenging times like this. Consolidation is going to be that's kind of the lay of the land. And so absolutely, you're seeing that. You're seeing some really interesting mergers, right? Yeah. You're seeing some, at big levels. You think about, companies like Livongo, going public and then, continuing the consolidation piece. So you're going to continue to see that. At the end of the day, who's adding value? Who's truly adding value to what we're trying to accomplish in terms of improving the health of Americans? And so that's where, at least that should be the underlying goals around some of this consolidation. Some of it's also going to be about market position. Who can leverage their size to drive the market in one way or the other. So that some of the consolidation is going to be around that as well. But times like this that's what's going to happen.
And I imagine organizations of size will better be able to handle the adoption of AI technologies.
Well,
more data, more AI, more.
So size matters. It's true.
Yeah.
Partly, and this is where size. I'll tell you where size is. In my opinion, where size is really critical, but where it also can be a barrier. I think it can be both.
Okay.
So let's talk about it from a provider perspective. So a health system, a cancer center, that perspective. Yeah. The larger you are, the bigger your resource base, right? So, because what happens in digital is in some ways doesn't matter how big you are. There's a certain baseline amount of investment you've got to make. And it doesn't matter how big you are. You've got to make that same baseline investment. So if you're much bigger, it's easier to make that baseline investment, right? So size really matters there.
Yeah.
But as you think about AI, for example, and some of these other digital technologies as well,
Yeah.
implementation is challenging.
Okay.
The bigger and more diverse your institution is. Because you imagine you've got a rural hospital in the Midwest, you've got an urban hospital in a large city in the South, you've got primary care clinics all over the place, you've got home health, you've got urgent care, and they're saying, hey, we have an AI tool implemented across the enterprise. That's 7 different implementations, and I only named 5 different things, right? So that's how hard it could be. So it actually can be, the implementation of these tools can be challenging, based on your size and the diversity of your overall enterprise.
Are you starting to see some departments benefit from it more than others, or is it something that's inevitably going to be a part of how we do business?
AI is going to be a part of how we do business, broadly speaking. So let's at some point in the future, when that point in the future is, I stopped trying to guess what the future is going to be after the pandemic, when things are just got turned on its ear. But at some point in the future, AI literally, in my opinion, will be baked into everything we do in healthcare, period. Okay. Where I'm seeing it really take hold is actually in the back office, the business operations. Okay. So think about in some areas, right? So think about opportunities to, and this is more automation than AI. So I shouldn't mix those terms. So let me talk about automation, then I'll come back to something else. So in the back office is where I'm really seeing automation really take hold, and it's slow yet. Because healthcare is, of course, always a little bit behind, right? Because we've been doing automation and back office stuff in other industries for a long time.
Yeah.
You think about rev cycle, you think about supply chain, you think about documentation and coding, right? There's a lot of pieces that can be automated there. Think about HR, onboarding, those kind of pieces, right? So that's happening, and I think that's really catching on, and there's traction there. And then what's going to happen, and what is happening, and there's a company that is working on this, a few companies are working on this, is AI is going to be layered into the robotic process automation. Okay. So now your bots are going to be AI driven, so that they're going to go and find your automation opportunities, and they're going to go and automate them essentially on their own. Right? So that's where the AI piece comes in on the automation side. Okay.
My mind is blown right now. Honestly. Is AI something that every healthcare practice should look for ways to leverage today, or how would they go about getting started? Or
it depends on who you are. If you don't want to have your own department, so we have a department of machine learning, and we have an AI officer as well. So we have a research department of machine learning, and we have an operations department in AI. So we expect to generate new knowledge and new experiences and new algorithms around AI. That's one bucket. A different bucket is you're going to be more of the consumer of those algorithms. In which case, what you're really looking for is who are the folks in the market, who are those players, who are those companies who can really help you accomplish your strategic aim or aims, leveraging their AI tools. So it's more about a market assessment than it is about deeply understanding AI in any sense of the word.
Got it. For maybe smaller organizations that don't have an in-house, AI team member, what would they do to leverage some of those technologies?
I always start with the problem. Right? Okay. So they have to start with your prioritized list of things you're trying to accomplish that you think a digital solution may be the answer.
Okay.
And then you go and look for those partners or those off-the-shelf products that are out there that can actually help you achieve your aim.
Yeah.
And if they have AI, great. It may not. So don't. I think AI is going to be baked into everything. But I wouldn't necessarily, if you're smaller, I wouldn't necessarily go out looking for AI. You go out looking for solutions. AI may get you there.
I love it. Here's a fun question. You and I today, we just jump in a DeLorean and we transport ourselves to 2030.
Okay.
What does healthcare look like in 2030?
So so human beings, and there's actually research on this, are really bad at predicting the future. So I'll be the first to raise my hand. I'm not good at prognosticating at all. I will say though that what we're seeing as a consequence of the pandemic, we will see a lot more of it. So virtual care, digital ways to connect with your patients and caregivers otherwise, AI and everything. And again, let's take the AI one step further. When I said AI is going to be in everything, I meant AI will be in everything. Wow. So I'm a doc. I still see patients in the hospital. What does that mean for me? That means that, for example, in 2030, which is actually not that far away, I'll still be seeing patients in 2030. Yeah. I will be seeing a patient in a room and having a conversation. I'll do an examination of them. I'll talk about the plan. And when I walk out of that room, I'll look on my phone, and the entire encounter will already have been captured and documented, and the orders that I wanted will already be sent off to the lab or to the pharmacy. That's AI with natural language processing and a whole lot of other components, right? So that's again, AI is going to be in everything. What else? Where else are we going to see it? I'm going to want to look at how well we take care of a certain diagnosis. How are we going to do that? Well, we're going to leverage data so well. Just that big data. I tend not to use that phrase because it's been overused, I think. We're going to be able to go back and search all patients who have ever had that diagnosis at Moffitt or anywhere else, depending on what our data set is. And then the AI is going to be able to basically develop a similar cohort of patients to who you're taking care of. And it's going to say, here's what we recommend is the best next step for that patient. That kind of thing. So really, truly helping you develop your treatment course. Here's another example. I mean, I can just throw examples on the AI all day long.
Yeah, no, I love this.
Imaging, radiology.
Yes.
So, and this is another place where AI is really gaining traction.
Right.
The AI is going to look at that image, and it's going to serve up to the radiologist, hey, here's what we think is going on. We think that this is a 1 millimeter nodule in the right upper lobe, but we looked at the old examination, exact same location, so we think there's no change. The AI will tell you that. Then the radiologist confirms it. Yep, you're right, AI, we'll keep going. Right? The AI is reading your...
I love that. That's great. Little known fact, I was a director of radiology at one point in time, previous life. I can appreciate that more than you can possibly understand.
There you go. Yeah, no, it's because right now it's really good at pattern recognition, these algorithms. Okay. And some of the specialties where pattern recognition is really important, think about pathology, think about radiology. Those are some of those areas where, you'll see the traction first, and you'll start to see by 2030, you'll get traction in true market solutions leveraging the AI algorithms. Those will be pretty much almost, I don't know about standard, but they'll certainly get quite a bit more traction in the market. They're out now, but they're not widely used or widely known.
Yeah. And you have to appreciate the fact that everything in radiology is digital now. We're not dipping films.
Exactly. Yeah, you must have been around for a while if you're still remembering dipping films. So yeah, because I remember having a light board in our conference room. You put the film up on the light board, and yeah, exactly. So yeah, we don't do that anymore.
Wet read. That's exactly it.
Exactly. That's the
processor.
There you go.
Got a few closing questions. It's said that leaders are readers. Do you have a favorite book?
I don't actually, really. And so I would say there's a certain genre that I do read, and honestly, it's not scientific journals. I mean, I do read those things, but it's if I'm going to read, I typically am reading for pleasure, and so I read science fiction. And I read a very specific subgenre of science fiction called space opera. So think of things like Dune, right? So if I would have a favorite book, it would be the first Dune by Frank Herbert. That would be, because I think about it's world building these worlds, and then building the technology and building the way that the cultures interact with each other and leverage the technology and all of that. That to me is fascinating. And I don't know if it helps in my job or not, but I just enjoy it either way.
Well, I think it would probably help you to think beyond the confines of what we know as being possible today, so I can appreciate that as well. But also big science fiction fan, so appreciate that.
Awesome.
Do you have a favorite quote?
I do not have a favorite quote. I mean, the only thing that comes to mind, I probably should have been prepared for this question, but
no, it's okay.
Is life is short. There's actually a longer quote of that, a Shakespearean quote of the life is short. But I think of it, life is short, not in the terms of, just kind of like throw things away or just, I think of life is short as in, if you have a bucket list, go get it done. Go just enjoy, be in the moment. Because with digital, with social media and all that, it's so easy to just, be in all over the place. Be in the moment, be present, and enjoy that time. Sometimes that means that you won't get a picture of whatever it is that you won't, but you will have a memory. And what's interesting about, again, there's research around humans, is that where the best way to spend your resources, if you actually happen to have disposable income, is not stuff, it's experiences.
Yes.
And so so to me, life is short is about finding those experiences.
I echo that sentiment 100%. It's when we're on our deathbed, we're not going to remember the big screen TVs that we had. We're going to remember the experiences we had with family and friends, and that's what will matter most.
Exactly.
What has 2020 taught you personally?
2020, what a year.
What a year. What a year.
I've learned flexibility. I've learned that myself, as well as my family, are exceptionally flexible and adaptable. And that is going to be a lesson that we will leverage for quite some time. So much so that we're thinking, okay, well, what is this? If we're this flexible and we're this adaptable, then what does this mean for, where the kids go to school, where we live versus where we work, like, how we travel? Should the kids even go to school anymore? Can they just do virtual school or homeschool indefinitely now, since we've done it for the last year? All of those things are now on the table. All those conversations are now being had. And it's a lesson learned from surviving, a pandemic.
Yeah. Final closing thought for our listeners. Is there any information or advice you'd like to share with that maybe healthcare executive that's on the other end of this listening?
So I would say, the one thought that I had along those lines is that we talked about a little bit. Strategy is really, really important. And so I want to reemphasize just how critical it is, especially if you're talking about really leaders at the leadership level, because the leaders are really creating that vision, articulating that vision, executing on that vision. Is let's not lose the forest for the trees, even though it's going to be painful. You may have hit some negative margin, quarters, which I get it. That hurts, but if you approach the work strategically in a way where you think that you can leverage the learnings that you're having to place yourself even better than you were before, build your strategy and build your team and build your execution around that premise that you can be better coming out of this than you were going in.
With that, I'll bring the show to a close. I feel honored to have been on the receiving end of this interview. I am going to walk away from this feeling inspired, and I'm going to be doing a lot more research on AI after this.
Awesome. Thank you. I really appreciate you having me on.
Thank you for joining us on the Healthcare CEO Show. If you've enjoyed this episode, don't forget to subscribe on your favorite podcast platform for more insights from the top. Until next time, lead boldly and care deeply. See you on the next episode.